Yes. So, welcome to part 2 of psychiatry and mental health nursing. So, after introduction to mental health and psychiatric nursing, you come to the main topics, which is now causes of mental health. So, remember at first we defined what was mental illness, and we said mental illness is a brain disease which can be severe or minor and affects someone's emotions, behavior, and thinking. So, some students were asking me to say in class, we didn't learn about mental illness. It means you don't understand mental health and psychiatric nursing. You can't say you don't understand mental illness. No. So now, no matter what or no matter how, they are going to ask you to say, explain the causes of mental disorders. Whether you like it or not, you are going to be asked that question. And remember, what exactly causes mental disorders is not yet known. What we have are the factors which can put a person at risk of developing a mental condition. And usually, if you want to find this easier, and these factors are discussed what we call biopsychosocial factors. So what can contribute for a person to develop a mental condition is number one, biological factors, number two, psychological factors, number three, social factors. So when a question is asked, the factors which can contribute for a person to develop any mental condition, just remember the word biopsychosocial factors. So here, that's where students miss a lot of marks. Just imagine if a student struggles to explain the causes of mental disorders. That means a student can also struggle when it comes to explaining the cause of any mental condition. So number one, as we said, what is exactly causing mental disorders is not yet known. What we have are the factors which can put a person at risk of developing a mental condition. And number one factor is genetics or heredity. Genetics or heredity. So this shows that if there is a history of mental disorders in a first degree family, that means there are higher chances that the next generation of that family can also develop a mental condition. For example, people studied the monozygote twins, also known as the identical twins, where they said when one of the twins has got a mental condition, the chances of another twin developing a mental disorder, it is above 70%. Not only that, another example is both parents. Suppose two people are married and both of them have got a mental condition. That means the children who will be born from those parents are also at risk of developing a mental condition. Even a single parent, even a grandfather or grandmother. And here you can say mental illness can be genetically inherited. So when you bring a point like that in the exams, you are guaranteed that you can get 6 out of 6. And the student should never struggle. Number two, biochemical factors. And in most cases, when we are talking about biochemical factors, we are referring to neurotransmitters. And neurotransmitters are brain chemical messengers which are produced by the neurons to conduct an electrical impulse. So, a person can develop a mental disorder due to disturbances in certain neurotransmission. When you have got the disturbances in certain neurotransmissions, it means there is a likelihood that you can develop a mental disorder. For example, people who have got elevated amount of dopamine, they are at risk of developing schizophrenia. Or maybe we'll say the drugs which block dopamine receptors in the brain, they have proven to treat the symptoms of schizophrenia. And also those medications which increase neurotransmissions like marijuana, they can cause the symptoms of schizophrenia. Not only that, but also people with depression, they have got reduced amount of serotonin. When you have got reduced amount of serotonin in the brain, especially on the neuromuscular junction, that can be a risk for a person to develop a mental condition. Not only that, but also glutamate is also implicated. People who have got elevated amount of glutamate, they are at risk of suffering from mania. And all those who have got a reduced amount of acetylcholine, they are at risk of developing dementia. So when you give those examples, no matter what, no matter how, you're supposed to get 6 out of 6. Then from there, endocrine factors. These can also predispose a person to suffer from a mental condition. So when we're talking about endocrine factors, we are referring to the role of hormones. So here you can say when there is hormonal disturbances, there is a risk that a person can develop a mental condition. For example, some people can develop mental problems after giving birth. We have got conditions like puerperal psychosis, puerperal depression, postpartum psychosis. These conditions, they come as a result of hormonal imbalance after giving birth. Not only that, some people can also develop mental disorders during menopause. There's a condition which is called the paraphrenia, schizophrenia of late onset. This condition develops in people who are during menopause, and this comes as a result of hormonal imbalance. Not only that, but also some people can develop a condition which we call it premenstrual dysphoric disorders. This can come as a result of hormonal imbalance, and this can come during and after menstruation. Yes. So number 4, infections. Certain infections can predispose a person to suffer from a mental disorder. For example, infections like acute malaria. Somebody who's got cerebral malaria, they can portray with the symptoms of mania. Not only that, but also encephalitis, then also meningitis, brain abscess, syphilis infection, HIV infection. All those can predispose a person to suffer from a mental condition. So that means when you have got certain infection, there is a chance that one can develop a mental disorder. Number 5, substance abuse. Chronic substance misuse is associated with the symptoms of mental disorders, especially those people who are abusing marijuana, people who are abusing alcohol, people who are abusing cocaine, sunko, all those drugs, codeine. So meaning that the chronic misuse of certain substances can predispose a person to suffer from a mental condition. Yes. Then vitamin deficiency. Some people can also develop mental disorders as a result of certain vitamin deficiency. For example, when you have got lack of certain vitamins in the brain, especially when you have got lack of thiamine, you can develop what we call Wernicke's-Korsakoff syndrome. That can come as a result of vitamin B1 deficiency. So lack of certain vitamins in the brain, that can also predispose a person to suffer from mental condition. Then we also have got environmental factors. Under environmental factors, we can talk about social environmental stressors. Certain major life changes in one's life that can also predispose a person to suffer from mental disorder. For example, that is when a person has got heartbreak, maybe loss of loved ones, financial loss of employment. So please, for today, we end from here. But I would prefer you invite your friends to like this page, because you might just be saving someone's life. It's me, Mr. International, Mr. Stable. And these videos are not intended for psychiatric diagnosis. They are intended for academic purpose only. If you want diagnosis, visit the nearest psychiatrist.